Hi. Welcome to our next edition of our new little podcast videos that we're doing here at Take Two. Today, I'm joined by Kim Schroeder, who's the clinical manager of Restoring Childhood program within Berry Street's Take Two service. And I'm going to ask her a bit about restoring childhood and also about family violence and the impacts on young children and the work that we're doing. So, welcome, Kim.
Thanks, Jen. Good to be here. Thanks for having me.
It's nice to see you remotely, given we're both working from home.
I know. Not the same as being in the office, though, is it?
It's not the same. It's not the same, but it is nice to see you anyway. And this is working reasonably well, I hope. So, family violence and children. So, I feel like family violence is front and centre in so much policy and action around government and in the community, but I feel like we just haven't shone enough attention on the children. How does family violence impact on young children?
In many ways, Jen. So lots of people have this perception that family violence only impacts on children and infants if they're actually present at the time. But in actual fact, if their mother or their caregiver is experiencing family violence and they're not even in the house, they're also impacted by that when they return to the house, because obviously the influence and the consequence of the family violence that's perpetrated, and all sorts of different family violence as well, on their caregiver or a mother impacts on them. So it can be directly towards them in physical violence or verbal violence, emotional environment violence, psychological violence, sexual violence, but it can also impact on them in great ways when they're even not present as well. So when they're in bed, for example, as well, people often think that won't impact on them because they weren't present at the time. Well, they're actually always present. They're always, experiencing family violence when family violence is happening in their home and within their family.
Yeah. So what kind of experiences will they be feeling? What will that result in for that young child?
Well, depending on what age they are, even with infants. So mothers and caregivers will play with infants, and people think that babies are too small to understand, to experience, and that they're not impacted. But in actual fact, the way that mum or the caregiver responds to their family violence, it can be the look in their face, it can be their distress, it can be their anxiety, it can be the detachment, so that they're not actually attaching to their infant, and that they're always walking on eggshells. So they're always walking on eggshells around the home and within the family, trying to work out how to protect their infant or their child and themselves.
Yeah.
So that
Absolutely.
can come out in a whole range of ways.
Yeah, great. So Restoring Childhood's a pretty new addition to Take Two. So Restoring Childhood actually started under the family violence team in the north at Berry Street, as well as in Central Highlands, I think, as well.
Yes.
Could you tell us a little bit about how that demonstration project, is what it was called, came to be, and how you've now come to Take Two?
Sure. So, Restoring Childhood was one of the 26 DHHS therapeutically funded family violence projects, which was as a result of the Family Violence Commission in 2016. So, from the Family Violence Royal Commission, there was 227 recommendations, and in recommendation 23, it was basically, it was a priority to provide therapeutic family violence funding for women and children who had or are experiencing family violence. So the demonstration of a project of Restoring Childhood came as a result of that across the Northeast and Hugh Moreland, and also the Central Highlands.
Yeah,
And
great.
it was just ran by Berry Street at that time.
Yeah, absolutely. So originally, I think there was a program called Turtle that we were very keen about working with infants and mothers. But this is for children all ages, isn't it? Now, Restoring Childhood.
It is. So Emma Toon, who still works at Berry Street, actually gave evidence at the Royal Commission, and she was, she actually set up the Turtle program, and it was with infants and mothers and small children, but we actually work with infants and children up to the age of 17 and their mothers.
Yeah,
Or
great.
primary caregivers. Yep.
And when you say work with, what kind of work does Restoring Childhood do with them?
So we do different sort of work. So we do specialist triage and intake. So that's basically assessing a referral and family violence risk assessment that comes in to see whether it is appropriate for our program. in restoring childhood. Then we can do a BRISC, which is a brief relational interventional screening. And basically that's 3 to 4 dyadic sessions with the mother and infant or child. Then we can also provide longer term intervention, which is CPP, so child parent psychotherapy, which we provide at usually around the 3-month mark, and we can do that up to about 12 months, give or take. And we also provide EMDR as well.
Yeah, great. So there are a whole lot of acronyms and words in there that a lot of people probably won't understand. So
Yeah.
dyadic, can you explain what a dyadic session is, please?
So dyadic session is, I suppose, in regards to what we provide is with the mother and infant, or mother and child, or could be mother and children.
Hmm.
And it's basically when disruption has happened to the attachment between mother and child. And so it's providing some security and some support in regards to establishing that attachment between mother and child again.
Okay. Great. So that would usually be a counsellor or a therapist sitting in the room with mother and her kids or child?
Absolutely. So to be one of our restoring childhood clinicians
Yep.
who are all therapists, and they come from different backgrounds. So some of them
Yep.
are clinical psychologists, social workers, they're trained in CPP, so child parent psychotherapy.
Yep.
And yeah, we also do some group work as well. So once we find that mothers are group work ready, we can provide groups like Peekaboo as well. So that's where we would also do some dyadic sessions and some play therapy as well, just depending on what the needs were of the mother and infant or child at the
Yeah.
time.
Fantastic. Fantastic. The other acronym that I think a lot of people won't understand there was EMDR.
Yep.
So this is a really interesting therapeutic tool. I find it fascinating. Can you kind of give us a brief overview if you can?
So do I, Jen, because I hadn't actually heard of it before I came to Berry Street. So
Yeah.
I had to look it up before my interview, to be honest with you. So it's eye movement desensitization reprocessing. And basically, it's a therapy that works on helping the brain reprocess these traumatic memories of family violence and trauma. And as a result, it alleviates emotional and psychological distress.
Yeah, great. Because a lot of these kids are actually experiencing PTSD, aren't they?
Yes, yeah. In actual fact, we find it brisk. So at the 3 to 4 session mark, we've found that 95% of children are actually displaying post-traumatic stress disorder
Yeah.
symptoms.
Which is probably a big revelation for a lot of people, even that children can experience PTSD. If you don't come from a therapeutic background, you sort of think PTSD is a veterans
Mm,
returning from war thing. But PTSD is about the trauma that a child experiences, not the actual behavior that's exhibited in the trauma, isn't it? I didn't
abs-
describe that very well, but
No, you did. And no, you're absolutely right. People do think about PTSD in terms of veterans and emergency services workers,
mm,
and people like that. But in actual fact, yeah, like I said, we found 95% of children were displaying symptoms of PTSD, and sometimes they obviously don't go into having a diagnosis of PTSD, and it doesn't have a huge impact on their lives. But for some children, where earlier intervention and intervention like restoring childhood doesn't come into play, that's when they can end up with significant symptoms and having a huge impact on their lives. The family violence having a huge impact on their lives. But we found that the 3 to 4 sessions during the brisk is that some children would then their symptoms would alleviate, and that would be all that they needed. That would be
which
all that.
is
Yeah,
just fabulous. The
yeah.
idea that early intervention after the incident,
Mm.
and that therapeutic assessment alone can be enough is just amazing.
Yeah,
So,
so we try to do it within 3 months of
yep,
the current family violence, Jen, and we find that that's usually the better outcome for these
yeah,
infants and
fantastic.
children. Yeah.
So, talking about outcomes, how can these sessions help? Like, what are you trying to achieve usually?
Mm. So we're trying to obviously alleviate the symptoms of PTSD, and we're trying to support an attachment between mum and infant, or mum and child or children, and make a narrative, or create a narrative, I should say, in regards to their story. So their family violence experience, their story together, and to take the blame off mum, because they often feel shame and blame in regards to the family violence, and that they haven't protected their infant or child from it. But in actual fact, they're a victim of family violence. So it's creating a story and making sense of that for them.
Yeah, absolutely. Fantastic. So if mum, is Aboriginal or perhaps a refugee from another culture, if they're gay, if they're lesbian, transgender, something, is there opportunities for specialist help within restoring childhood in those fields?
Yeah, absolutely. So we're in partnerships
Hmm.
across the four regions in Victoria. We're in partnerships in each of the different regions. So in Northeast and Hume Moreland, we're in partnerships with services that provide cold specific services. We're in partnership with VACAR, and we're in partnership with GLBTI,
Hmm.
QA plus. Service providers, and also disability service providers. And we're also in partnerships in Central Highlands and in the Mallee as well.
Fantastic. Fantastic. So it's confusing with all these partners, but if people want to access the services, the best place to go is to the Berry Street website. And we've set up a new page that's berrystreet.org.au/restoring childhood. So if anyone watching this does want to refer themselves, they should follow the process that's outlined on that page, because it is different in each of the regions. And unfortunately, that's the process. But anyone can access this if they do meet the criteria. And those general criteria are that the caregiver needs to prove that they're in a safe place through a risk assessment tool. Am I right in
Well,
talking about
yeah.
this? Do you want to
So
explain
often,
this?
yeah, absolutely. So often we receive referrals from the Orange Door or
Yeah.
from Child Protection, but certainly it can be from self as well. And we are actually working with families that are currently experiencing family violence as well.
Oh, okay. Right.
So we have adapted our work over the past few months in regards to COVID-19 restrictions, because obviously there's some, sort of complicating issues with perpetrators of violence being in the home, and we don't want to exclude those families. So there's a lot of measures that go into place in that regard. However, women can refer self, but through the Orange Door, so the
Okay.
Northeast Orange
Fantastic.
Door. Yeah.
Yeah.
And they don't
Okay.
have to keep telling their stories multiple times either. So I think that, just touching on the partner conversation that we had, is that, in regards to being able to address everybody's needs, we don't expect women and children to tell their stories multiple times. And that's why we have those partnerships in place, so that we can wrap around and provide what's needed to
So
everybody.
important, the re-traumatization of people having to repeat their stories over and over for lack of us being in the right place is very true. So I'm really glad to hear that. See, you learn something even when you work within the same program.
That's right.
Fantastic. Well, I really encourage people to, if they feel like they want to know more about restoring childhood, to have a look at that web page. I'll post the URL of that web page with this video. So have a look at that, and reach out if you feel like you might benefit from restoring childhood and from the hugely skilled and expert and huge levels of expertise that sit within restoring childhood. I know a lot of your therapists are extremely experienced
Mm,
and just gorgeous, lovely, friendly, caring people. So
mm.
we don't judge, and we're here to help.
Absolutely. And if people aren't sure, we can also just provide secondary consult as well, Jen. So there's the main number of Berry Street, and an email address attached to NHARP and to each of the regions of Restoring Childhood. And we'd be more than happy just to have a conversation if people aren't sure or they have questions.
Fantastic. Thanks heaps, Kim. I hope that has been useful for anyone watching, and I appreciate your time today.
Thanks.
See you in person sometime in the future.
Hopefully sooner rather than later, Jen.
Sounds good. Thanks, Kim.
Thanks.